Welcome to our case-based discussions. We will be discussing cases and reflecting back on what went well, what could be done better, and what we learned from these cases. I'm going to be talking on the implant journey of a patient. Anne was referred to me in 2016 with concerns of a mobile upper left deciduous canine tooth. She had concerns particularly that the tooth would exfoliate and it would leave her aesthetically compromised. Her medical history revealed she had type 2 diabetes. The importance of this, particularly for patients undergoing implant treatment, is to assess their records from the general medical practitioners of the HbA1c levels, which establishes how well controlled their diabetes has been over the past 12 or 24 months. The other thing to assess is what medications they're taking for their diabetes. Patients who take a cocktail of medications usually reflect that their medical condition is not well controlled. There were no other obvious factors for Anne to be considered in terms of a consultation appointment, so we went to the next phase of planning. The question to ask here for me in terms of planning is, I will be replacing the canine tooth, and what occlusion am I going to consider? An adult looking canine tooth, am I going to convert this patient into canine guidance? And if I did, how will that impact the outcome of my implants in the long term? Does this really matter? Or do I maintain the patient's current occlusion, which is very likely to be group function, but in that case you may end up with a slightly shortened clinical crown height compared to the canine the patient may have on the contralateral side. Do we need a CBCT scan? Do we do wax-ups? And if we do, use this to then subsequently provide radiographic or surgical stents. What are we looking out for from the wax-ups? Where does the cervical margin of the wax-up finish? And is that exactly the cervical margin of where our final restoration needs to be? Because that will determine the apicocoronal position of the implant placement. If we were to do grafting, where is the grafting going to happen? And would this then mean we do a one-stage approach or a two-stage approach? What do we put in the position of the missing deciduous canine tooth? Because the patient has aesthetic concerns that do not want to stay without a missing tooth. And if we do order surgical stents, do we use the radiographic stent we used for our surgery? Do we need different designs? So these are various factors that we have to consider when planning a case of this nature.